In the last year, more than 20,000 Londoners were diagnosed with diabetes, taking the total up to 452,000 diabetics living in the capital. In London, all but 9 areas are above the national average prevalence of 5.9% of the population, with Brent, Harrow and Newham having the highest rates of all. Currently, 10% of the NHS budget is being spent on diabetes, so health experts and charities are desperate to raise awareness of the condition, particularly in the capital, where it's estimated more than 143,000 people are walking around undiagnosed.
The reason why we have higher numbers within London is in part because of the diversity of our populations. We have people in London from diverse groups, South Asian groups and African Caribbean groups, who are 2 to 4 times more likely to have diabetes, type 2 diabetes, than their white counterparts. So in part, we have that issue. London has, as well as the rest of the country, a problem around obesity. About 80% of people with type 2 diabetes will be overweight when they're diagnosed with the condition. So we need to look at how to help people to maintain a healthier lifestyle, to lose weight, to take more exercise. And people need support in doing that. It's not just a question of sending them off and telling them to do it. They actually need support from their healthcare professionals and from public health professionals to be able to maintain a weight loss and a good exercise balance.
Newham has seen the second biggest increase of diabetes in the last 3 years. One Newham resident who was diagnosed with type 2 diabetes 24 years ago told me how most of his relations in the area are diabetic, but ever since his diagnosis, he's been determined to keep it under control.
The medication, metformin, that is 2 tablets in the morning, 2 in the evening, and I'm watching my food, whatever I eat, and also doing a lot of exercise. I go to gym, I go to a swim, and I also go for a walk, and the walk is at least between 3 and 4 miles. I have my own fridge. I go and buy my own food. I check the food. I got the phone with me. I put online and I check that ingredient, whether it's good for me or not. And in the morning, I make my own breakfast. And that breakfast, what that contain is my own choice. And my choice is always because I got to control my blood glucose level.
As the number of diabetics in the capital gets higher, health professionals across London are working even harder to educate people about the condition. And their message is clear: a healthy lifestyle is the best prevention, as there is no cure.